right along, I'm now going to be doing my intrapartum assessment, which is very similar to my antepartum assessment, but it's a little bit more in depth about the whole labor process. So I have my patient here. I'm going to introduce myself to the patient, perform my kiwis, and I'm going to let her know exactly what it is that I'm going to be doing. That I'm here to just perform an intrapartum assessment for her and note the different stages of the labor that she is in between stage 1, 2, 3, and 4. So starting right out, I would obviously perform my vital signs. I'm going to go ahead and check her blood pressure. I'm going to check her respiratory rate, her O2 stats, which are super important. Making sure she's connected to the monitor so we can monitor her, what her heart is doing and what the fetal heart rate is. And I'm also going to check a temperature for her. At this time, I would also weigh my patient. I need to have a weight for her. And I would also be palpating her fundus just to feel how everything is. Palpate it. And it's super important. I would want to palpate the fundus as she's having a contraction so that I can tell the strength of the contractions, whether they're weak, whether they're strong, and how harsh they are for my patient. I would also be assessing her for edema. So I'm going to mainly look at her extremities. I'm going to look at both legs, which is where she would normally have some edema. I'm going to look at the arms. I'm going to be looking at skin turgor, which is a great sign to see whether the patient's hydrated or not. Again, I'm going to assess those contractions. I see that her skin turgor is good, meaning she's pretty hydrated. So that's good. During this, I'm also going to be assessing the fetal descent to see how far down my fetus has gotten, how close it is to being delivered, and this will determine which stage she is in of labor. I would also be assessing her dilation. So I'd be looking down at the perineum, assessing her dilation to see how much she's dilated. I'm going to also be looking here to see if she has any genital warts, if she has any redness, any swelling, any bruising down here, which she does not, because I do know that if she had any genital warts, she would not be having a vaginal delivery. I would also be assessing for any cervical effacement. Okay, and we are going to be again assessing those contractions as we're going through our intrapartum assessment. Now that I've got all that done, I'm monitoring my patient's O2 stats as this is going on, making sure she's comfortable, and it's super important to assess her for pain. I'm going to ask if she's feeling any pain. If she is, where exactly is the pain? Another thing that I'm going to be asking as I'm doing my assessment on her dilation and her perineum down here, I would also be noting whether there's any drainage or any fluid from the amniotic rupture, and if there is, I would be asking her how long she's had that, when that started, and about the time frame of which it's been going on. Once I've gotten all of that done, I'm monitoring my patient throughout all of this, making sure her vital signs are good, her O2 stats are still up, and then we can move on to the second stage of labor, which is actually the delivery portion where the fetus is going to be actually coming out. At this point, I would see what part is presented through my cervix, whether it's the patient's baby is breached or if it's head first. Obviously, if it's breached, we're most likely not going to be having a vaginal delivery. It's most likely going to be a C-section, because we don't usually want to deliver a breech baby, because if the butt comes out first, typically the cervix will not be open enough for the baby's head to come out as well. So we'd be looking at the presenting part, so I would be assessing, making sure that it is the actual head of the fetus that I see here, and I'm going to be monitoring the patient's fetus's heart rate, and then we're going to be moving on to the third stage, which is the delivery of the baby, and then the delivery of the placenta, which follows directly after the baby is delivered. Once the placenta has been delivered, we're obviously going to be assessing that to make sure that the placenta is still intact, making sure there's nothing missing from it, because sometimes if anything of the placenta is left inside of the patient, it can cause serious infections and it can be fatal to the patient if any part of the placenta is left inside. So it's very important to monitor and make sure that the placenta comes out as a whole and intact, and that everything is removed from the patient, because we don't want that from there. And then the fourth stage of labor is the first hour postpartum after the baby has been delivered, where we're still going to be monitoring our patient's vital signs. That's super important. And we're also not going to be monitoring the vital signs of the fetal heart rate. We're going to be monitoring, making sure that we see some variations on the heart rate of the baby and the mom, because we never ever, regardless of mom, baby, elderly, we never ever want to see a flat line as the heart rate. That is asystole. We never want asystole. We want everybody alive and well. So we want to see some variations in the fetal heart rate. After that, we're still going to be making sure we keep our patient clean, because following the delivery of the baby, there's going to be a lot of blood. There's going to be a lot of fluids being drained from her. She's going to be super exhausted. So it's super important to make sure we're keeping her comfortable, while we're also going to be keeping her nice and clean. So I'm just going to be assessing the patient's perineum afterwards. After the baby's been delivered, I'm going to be assessing the lochia, making sure there's no odor, making sure there's no smell. And at this point, the fourth stage is mainly about keeping our patient comfortable, making sure everybody's heart rates are up, their O2 stats are good, their vital signs are looking good. And at this point, I will be continuing to take my vital signs every 15 minutes up to, usually it's like every 15 minutes for an hour, and then every 30 minutes for another hour, and then so on and so forth. But the vital signs are super important after. And that's really it with my intrapartum assessment. Thank you.